All right, thank you. Good evening. Thank you for being here. We are Team A, and our proposal is the Armed Forces Against COVID-19. Our team consists of Jaxen Howell, Noelle Gushard, Lauren Welch, Ben DeLeon, and Grace McKeehan. Our objective is to create a low-risk campus environment that could exist after executive orders have expired within the $5,000 grant. Our team has personally benefited from our experiences on the campus over the last 4 years. Therefore, we are passionate about reducing viral transmission so students can return to campus and benefit from the abundant opportunities the university has to offer. We plan to target campus locations that experience the highest volume of students and offer solutions that limit both contact and air transmission. These ideas are advantageous because they are easily implementable, sustainable, and build upon current infrastructure, allowing them to be scaled to other universities. Our proposal does not offer only short-term solutions for COVID, but would improve the health and efficiency of universities and limit the spread of other seasonal illnesses. Jaxen will now explain how we created a land, air, and sea approach to fighting our invisible enemy on campus.
All right, so in order to achieve this goal of reducing viral infections across campus and making students feel safe, we would request $5,000 to implement our three-pronged solution composed of land, air, and sea components in order to combat COVID-19 using step and pull devices, wellness rooms, and a patient tracking system. For our surface transmission solution, we would use a product called Step and Pull, a small device you attach onto the bottom of a door so you can open it with just your foot. This device would be installed on push-pull bathrooms across campus to reduce contact with door handles because, as studies have shown, door handles are one of the greatest bacteria carriers that we use on a daily basis. These devices are inexpensive and can be easily installed, requiring only a drill and a few screws. Looking at medical expenses data for COVID-19, our Step and Pull solution would effectively pay for itself by preventing just one student infection. For our air transmission solution, we propose converting 18 rooms in Daniel House into designated wellness rooms for housing students who become ill in order to prevent viral spread. By identifying ill students and assigning them to these temporary wellness rooms, we could prevent the infection of the students' roommates or friends, as well as whoever they may infect. Converting these rooms would come at no direct cost to the university, with the only expense being lost room and board revenue. Additionally, we propose SMU reimburse ill students for online meal deliveries up to the value of a daily meal on campus. Due to the apartment style of Daniel House, students can cook for themselves and further minimize campus exposure. On a related note, college attendance rates are expected to be in decline in the near future. From our personal survey data on 95 SMU students, over 6% of students expressed moderate to extreme concern about their future college enrollment status due to economic uncertainty, making it likely that some dorm rooms will go empty in coming semesters. Implementing this plan will not only come at little to no extra expense to the university, but will provide peace of mind for students and their families. And with that, I'll pass it back to Grace.
Our C solution is observing student symptoms. Symptom tracking is vital to public health as it allows for early detection and interruption of a viral transmission chain. Our program utilizes Pegasystem's COVID-19 tracker that is currently being used nationally by both corporations and hospital systems. It is offered free and can be integrated into the student database within a week. The symptom tracker is easily accessible to students and faculty via email and provides them with the ability to self-monitor their health and alter their own behavior to reduce their risk level. The systematic collection of data allows the program supervisor to identify trends in student health, and the university can tailor virus suppression efforts over time and location. One foreseeable barrier is a lack of student participation. This would be counteracted through a rewards program, which would offer coupons to local businesses. This program not only benefits the SMU community, but will provide a way to support local businesses in a hurting economy. This infographic describes the health tracking process. First, an assessment will be sent out weekly via email to collect symptom data and information about the COVID-19 positive patient contact. If a student is flagged as high risk for contraction of the virus, they will receive a notice advising them not to go to class and to schedule a telehealth appointment with the health center. If a medical staff confirms the student is high risk, they will advise them to visit the health center to receive a COVID-19 test. If their test comes back positive, the student will be advised to isolate in one of the above-mentioned designated wellness rooms. Additionally, an automated alert will be sent out to peers the student may have come in contact with in a classroom setting and prompt those students to fill out their own risk assessment. Lastly, students would be advised to submit an updated risk assessment every day for the subsequent 10 days they're in the wellness room, so the health center can monitor their symptoms and they will verify when the student is safe to return to class. Ben will now discuss our timeline and communication plan.
Thank you, Grace. It's very important to disseminate knowledge about our solutions across the student population. So we plan to add a training course on Canvas similar to those in the past, like that on sexual harassment. The course would include information about each of our 3 solutions, including the benefits they would bring to the SMU community as a whole. In the case of asymptomatic students, universities must make students aware they can contract the virus without knowing it, and then emphasize how to prevent the spread of infection by utilizing the step and pull devices mentioned and hygiene techniques such as hand washing. Our course is designed to address these issues and increase use of our solutions. Additionally, in order to increase awareness of our solutions, here are a few mock-ups of flyers we would distribute to faculty and staff via social media, email, and physically on campus. They include general information about our 3 main solutions, as well as reminders about how students can help keep SMU healthy and operating by stopping the spread. The 3 solutions we've outlined are implementable within the 90-day timeframe requested by the Safe Schools grant. Step and pull installation will take 8 weeks of work. Wellness room preparation will take 9 weeks of work, and the health tracking software implementation will take 12 weeks of work. This timeline was made specific to the SMU pilot program, but can easily be adapted to other colleges. This is just a brief and general outline of our timeline, but we're confident it can be implemented just in time for the fall semester to begin. As Jaxen and Grace explained, Pegasystem's COVID-19 tracker is currently offered free to organizations, and the wellness rooms require no out-of-pocket spending. So our surface transmission solution is the only one that requires funding. We plan to install step and pulls on all bathrooms in each of the campus halls that hold classes. Using information from SMU's website on their educational buildings, we were able to get a good estimate of how many devices we'll need. A more accurate number will be obtained when our team can physically survey buildings for bathrooms. So we calculated an estimated 156 bathrooms, and at $29.95 per step and pull per their website, we would need about $3,800. We would also purchase 500 of the flyers mentioned previously, which could be done at Staples for $160, and that would leave us with $1,040 left. With this, we could either purchase an additional 37 step and pulls for about $1,038 in case our estimate was low, but if not, the remaining money could be used to pay the wages for the workers who will install the devices. We conservatively estimate that SMU maintenance workers can install 7 step and pulls within an hour. With an hourly rate of about $46, we would pay $1,025 to SMU's Office of Facilities Planning and Management. I will now pass it to Noelle. Thank you.
Thanks, Ben. Our solutions clearly have large benefits, and we have the numbers to back it up. Business Insider reported that the average cost of treatment for a college student that contracts COVID-19 is $3,600. Seeing as 40% of people within a facility can pick up viruses from commonly touched objects, our step and pull will save the school and its students large amounts of medical costs. As for the wellness rooms, we found through our survey that 12% of students will not be returning to campus unless the university comes up with a contingency plan to relocate students with COVID-19. The university can recover that potentially lost matriculation revenue by using the rooms that would be left vacant from the 6% of students that won't be returning due to financial reasons. From data regarding the proportion of young adults who have contracted the virus, we have conservatively estimated that 128 to 160 on-campus students per semester will be infected with COVID-19. The PEGA symptom tracker will allow the university to prevent this number from getting even larger. Besides the university, our solutions will have a really great impact for the community as well. We are piloting step and pull on SMU's campus, but it could be used as a citywide solution. Our wellness rooms encourage sick students to stay on campus, which will limit the spread of the virus to the local community. The PEGA COVID-19 Tracker Rewards Program engages and supports local businesses by stimulating student spending, and the data collected by the symptom tracker can be shared with the Dallas County Health and Human Services Department to aid the city with contact tracing. Using these impacts, we were able to estimate our return on investment. The cost components of this proposal include the step and pull purchase and installation, the loss of revenue of the 18 rooms we would be converting to wellness rooms, and the cost of meals that will be reimbursed to infected students, which is a total of about $270,000 to $283,000. The value brought to SMU and its greater community comes in the form of avoided medical costs by decreased surface transmission from the step and pulls, recovered matriculation from students who are demanding a COVID-19 contingency plan, and increased community spending from the PEGA Tracking Rewards Program. These benefits total up to $3.7 to $3.9 million in positive impact. Considering these cost and impact factors, our project is expected to deliver 14 times return on investment. Now I'll pass it off to Lauren, who is going to talk about how we will evaluate our success.
Thanks, Noelle. So in order to ensure that we're achieving this return on investment, we'll be utilizing a variety of evaluation strategies. These strategies will be completed over time in order to continuously track our impact. For patient tracking, we will need to be constantly tracking the number of students who are completing the health assessment, as well as the frequency of completion. It'll also be important to look at the number of students who are seeking medical attention from the health center, as we would expect an increase in this number due to referrals from the assessment. In evaluating our step and pull service transmission solution, we will want to ensure that the step and pulls are being frequently used. This will be best done by surveying students, asking them how often they themselves are using the step and pulls, and we'll also use volunteers or the student wellness champions to observe doors with installed step and pulls and record how often they're actually being used. With wellness rooms, we will track the number of students who are using the rooms and how often the rooms are needed. And we will also closely track the infection rate among residence halls, especially those in which a student using the wellness room lives, in order to track how well the rooms are actually working in preventing transmission. And lastly, when evaluating the impact of online training, we will track completion rates of the course, and then also check in mid-semester to evaluate the impact the training had on levels of fear and overall knowledge. And summarizing our proposal, we are requesting $5,000 in order to implement our land, air, and sea solutions. These solutions will have great impact, with the step and pulls decreasing transmission by 40%, wellness rooms easing students and parents' fears and concerns, and the tracking system increasing community spending and decreasing transmission. As mentioned before, the implementation of these solutions will result in 14 times return on investment. We're confident in the potential of these solutions to promote a safer, healthier campus, and we look forward to seeing the positive impact that the Armed Forces Against COVID-19 plan will have on SMU's campus, as well as other campuses in the future. And we will now take any questions from the judges.
Great. Judges, if you could unmute yourself, and I will allow you to ask questions in any order you'd like.
I have a question about the software application, the PEGA. First of all, how difficult is that going to be to convert to university use? And second of all, can you track movement of people with that device, or is it simply to report your symptoms?
Hi, thank you for asking. So my name is Grace, and I talked about the C solution. So it would be able to be implemented within our SMU portal within about a week. I had a conversation with PEGA 2 weeks ago to talk about how that implementation would work. And then regarding tracking location, so a lot of apps that are currently in development track location. However, our team decided that that's not the best way to attack COVID on campus, because we're such a dense population, and also the tracking requires that students are self-reporting if they're positive for COVID-19, whereas our demographic is not the population that's getting tested. So we decided to use symptom tracking via email, and like we mentioned earlier, we would use a rewards program to encourage students to use it.
Great, thank you.
Thank you.
Hi, I have a question. So I'm curious about your wellness rooms and whether you had a chance to maybe talk to facilities about whether the residence hall spaces as they are properly equipped to reduce air transmission.
Yes, so we weren't able to talk to Relish since they are very busy at this time. We have reached out to them. But we did consider all the different residential hall options on campus and then we ended up picking Daniel because it fit all of our criteria. So we wanted to go with a dorm that had a small size, so we weren't necessarily condemning like an entire dorm. And then we wanted something that had a kitchen in unit, so students wouldn't have to go out to the dining hall, so they could cook their own meals indoors. Also with a bathroom in unit, because community bathrooms would also allow the spread of the virus. A separated location and kind of away from the main part of campus, non-exclusive to any kind of student groups. Service House and Dyer are small, but they serve certain people on campus, and we didn't want to take those dorms away from them. And then restricted airflow, So I did talk to Dr. Mindy Sutton Ross about about how the airflow in like some of the older dorms isn't too great. So we expect with Dan being newly renovated that there will be better airflow, and there won't be airflow in between all of the different rooms.
Great, thank you.
Mhm.
So I have a question. Your land, sea, and air strategy seems to focus primarily on students, and that makes sense given that they comprise the largest segment of our campus population. But I was wondering if your group considered any kind of strategies that would be focused on faculty and staff, many of whom students come into frequent contact with as well.
So I can speak to that. So we didn't come up with strategies that were specifically for staff and faculty, but putting the step and pulls on the doors, so staff and faculty will be using the bathrooms. And our purpose of putting those on the doors is with so many people touching the handles, that's just a huge increase in just the potential for a virus to be spread. So that would indirectly affect everyone who comes onto campus. And then with the symptom tracker, so I talked about it specifically from a student perspective, but it would be open to faculty and staff as well.
Yes, great. And I also, we included undergraduates, graduates, faculty, and staff in our impact evaluation for the step and pulls.
Great, thanks. And then I do have a follow-up question regarding the PEGA platform, symptom tracker. I wanted to know, as you think about implementation, who would have access to that information? And then I was curious as to whether or not the software solution is HIPAA compliant.
So it is currently being used in hospital systems. That's actually why PEGA created it. So yes, it would be compliant. And from a corporation standpoint, which is what I talked to the PEGA about specifically, is you would have a director or an HR faculty member from SMU. And so SMU would be able to decide if they wanted that to be someone from, let's say, HR, or if they would want that to be a staff member from the health center. So you would just give one person access to it. And then the information wouldn't be spread anywhere else. It would be HIPAA compliant.
Thank you.
So this is Peter. I have a couple of questions, but first just a remark. We have 5 wellness pods already on campus for quarantining students. And we've used them actually already this summer this spring for a staff member. So that's just an FYI. So let me ask the question, why limit it to bathroom doors? Classroom doors are going to be at least as much opened and handles used, I would expect, as bathroom doors. And in fact, the typical situation, they'll be used, one after another by students entering the room. So why the focus on bathroom doors?
I could speak to that. So first of all, with the step and pulls, they can only really be installed on doors where you don't have to turn the handle to kind of unlock a lock. So that limits the number of doors that the step and pull can be installed on. Because if there was like a handle you would have to turn, you would just be pulling the step and pull and it obviously wouldn't open. You also have to consider how heavy the doors are, because some of the outside doors on college campus buildings are very heavy. And so even if you maybe did install them there, it would be so inconvenient that people wouldn't necessarily use them. As for the wellness pods, yes, we were aware of that with my conversation with Dr. Sutton-Noss. We talked about it. Cost-wise, it looks like it would be about the same as creating these wellness rooms on campus. But from our survey for SMU students, we found that 5 times more students would want to stay in a dorm than in a wellness pod, probably due to the stigma that it kind of connotes with staying in a kind of like a hut tent out in the middle of a field.
So let me ask a follow-up question on the doors then. If you're limiting it to the bathroom doors because of difficulty opening and closing those doors, the other doors, is this really going to help slow the virus down if so many others are going to be using the other doors? So what impact is just focused on the bathroom doors going to mean for the slowing of the virus?
So one reason that we also focused on the bathroom doors was it was just a really good starting point, because we from memory we realized that a lot of the doors were compliant, but we absolutely would love to eventually implement it to other doors that over time we would be able to, once we could be back on campus, evaluate some more of the doors and see which ones would be compliant. But part of that is just the limitation of not currently being on campus, and not being able to fully analyze and look at all of the different doors in different buildings on campus to see which ones are most compliant. So we definitely would like to expand on that. And we do, if we do end up having a little bit of that extra funding, would definitely look into using that to install the doors in sort of install the step and pulls in a wider variety of doors.
All right, so one final question. You talked about students being quarantined in Daniel House or the wellness pods. What implications does that have for students in terms of course instruction? I mean, it sounds like that will require that we have all of our courses in some online format for those particular students. Is that the implication?
Yes, that was our original thought, is that it should be easy, relatively easy now, for professors to maybe record their lectures, considering that so many of professors are doing courses online now. So how it would work is, you know, students would go to the wellness rooms as by recommendation with the doctor, so they would have a doctor's note that they could send to teachers to excuse themselves from the classes. And hopefully the professors will send them recorded lectures.
Thank you.
Any other questions?
Yeah, so I have another question. This is Casey Majay speaking. So it's clear that the step and pool was your primary mitigation strategy that your group considered. I'm interested to know what other strategies did you consider, and what other changes to daily campus life do you foresee would need to be in place to mitigate the spread of this disease?
For sure. So we had a lot of different options that we had talked about at the very beginning that we weighed against, again, certain criteria. So we were talking a lot about the dining halls and about how maybe a certain dining hall would have to be converted completely to go, and having like self-ID scanners in the dining halls, you know, because currently we hand our IDs to the great SMU staff who then swipe it, but then that's just a lot of surface transmission going on there. So those were two things that we definitely foresee, but just didn't really fit in with this project due to just general like budget and resourcefulness. We'd have to switch around a lot of scheduling with staffing, which we just weren't able to do. Yeah, and another thing, I guess, with furniture removal, we were thinking about just removing furniture in common spaces like Fondren, just to naturally limit the amount of grouping of people in those common spaces to prevent air transmission. But here, yeah, you can see some other solutions that we had come up with, but they're great solutions, just that couldn't be implemented by us or in the constraints of this project.
Thank you.
Mm-hmm.
Any other questions for this team? I guess I'd also then open it up to any of the family members, any or others from SMU who are interested in this particular topic, who may have some questions. And I have a couple of assistants who are here helping me since I can't see everybody's hand. If somebody notices
final schedules, like your final is May 11th at 9:40. Right? If anyone has a problem with that time, just let me know. I have a question. Sorry.
Lauren.
You just unmuted everyone.
There is a way to raise your hand. Okay, there's a way to raise your hand, or you also can send me a chat message, and I can also acknowledge you that way. Great. And so we have Scotland Manson. You have a question?
Yeah, my question is, how will people who are disabled, who are in wheelchairs or have lower mobility of their feet and legs, how will they be able to open these doors? Say if they have to go to the bathroom and there's no one around them.
Great. And team A, did you hear that?
Yeah. So the step and poles are ADA compliant, so there's no trouble there. We're not removing the handles from being like taken off of the doors. So there will still be that, like people who are in wheelchairs will still be able to open the doors. But to kind of encourage people who can use the step and poles to use them, their step and pole sends with their products some decals to put on doors to kind of put at eye level that will draw people's attention to look down at their feet and use it. So there will still be both options to use the handle and the step and pole.
Great. That's an excellent question, Scotland. Thank you. And also final question from Evan Schumacher.
Hello. I saw in your, it looked like in your budget, it seemed as though you had factored in matriculation, how you would get people back matriculating that you may have lost. Can you explain how that would happen?
Yes, like the numbers are specifically how it would happen.
I guess I just didn't quite understand how the systems you had proposed would increase matriculation again.
Yeah, gotcha. So we asked students how likely they would return to school, how likely it would be for them to return to school if their school didn't create a plan to relocate students who contracted the virus. And 11.6% of them said that they would be very unlikely, which means that SMU and universities everywhere really need to find a way to relocate students who have the coronavirus. And this could be really any, we thought of different options of how this could really work. People who are local to Dallas can just go home if they choose to do so. But for the 2/3 of students who aren't local to Dallas, they really have no place to go. We can't send them on a plane and to go cross country because that would really transmit the virus to other people. We can't really necessarily send them to a hotel room because we don't know if hotels would be willing to accept those kinds of patients, and there could be lawsuits down the road. So really the only way that we can create a plan to relocate students is on campus. So we took, here are the numbers here, 11.6% of students that live on campus is about 371 students that are likely not to return. And we took the average semesterly room and board for these students at SMU and multiplied that by the students not likely to return to find the total matriculation decrease value that could be redeemed again by SMU if they implemented our solution.
Great, thank you, Noelle, and thank you all, Team A. It was an excellent presentation.